centers used to be places where you go to quit drugs and alcohol cold turkey. The model worked, but in many cases fell short when it came to long-term recovery. In this week's First Look, we take a tour of the state's newest detox facility in Harrington and examine the new approach that state health leaders hope will help people beat their addictions for good. Delaware's newest 28-bed drug detox facility in Harrington was almost full on the first day it started seeing clients in early November. Connections Community Support Programs runs the downstate center that, as it turns out, is about more than just detoxification.
There were people who would go to detox, they'd go and they'd get clean and they'd come back out and they wouldn't ever get any additional recovery supports. They'd eventually use again, sometimes within a matter of days. They'd go back to detox, they'd repeat the cycle.
Connection CEO Kathy McKay says some would detox 40 times in a year and be no better off in their recovery. That's why state health leaders stepped in asking, how can we change this?
So their idea was that, to set up facilities that had these levels of care. So the 23-hour sort of observation, so you can really figure out what's going on. If you need medical monitoring for 5 to 7 days, you can move into an inpatient bed. If you don't, if you can just get started on some other course of action while you're in the 23-hour bed, you can move right over the next day into intensive outpatient, which is also in this facility.
Every bit of support you could possibly need to get clean and stay clean, consolidated in one place. That sort of convenience is what Director Daphne Chenese-Rico hopes makes a difference long term.
I think that's such a big step, just to walk through the door and say, I need help. We're here to help them with the detox process, but we're also here to connect with them when that period is over. We make them aware of our intensive outpatient programs and that when they're done the detoxification period, it's not over. We're still going to be here for them as far as resources and support.
That's new. Another new concept, about half of Connection's staff here are people in recovery.
These centers used to be very medical and mostly nurses, and we do have a lot of nurses here as well, but the concept of having those recovery coaches, which is what we call them, to really help you to think about what do you need to do for the long term to make a difference in your life, that's new.
Carolyn Faust is what Connections calls a recovery coach.
It means that I'm their cheerleader. It means that I'm their guide. It means that I am a peer, which means that I have been where they are.
3.5 years clean from drugs and alcohol, Faust uses art therapy to illustrate how addiction hurts those you love.
And it also gives them evidence that they maybe know more than they realize about how to do this. Recovery Road was their opportunity to draw the road, to make it tangible. What do you have to have on it? Do you maybe have to go to the DMV? Do you maybe have to start the 12 steps? Do you maybe have to go find a job? What do you need as those supports to get you to the road to freedom? And the road to freedom is freedom from active addiction. I am the hope. I'm the physical evidence that recovery works, and our goal is to give them the hope that they can do that as well.
And the hope that this time, the recovery will stick. Connection CEO Kathy McKay estimates it'll cost about $2.5 million a year to run the detox center. But because offering levels of care in one place is new, McKay says the numbers are fluid. Now, the money is expected to come from the state for the uninsured, Medicaid, as well as insurance companies.
So is this new approach in effect at the Kirkwood Detox Center too?
It is.
And where does Delaware stand kind of in terms of the overall addiction epidemic?
So by the numbers, DHSS statistics show across the board increases in all 3 counties of people seeking treatment from state-run facilities. That's from 2014 to 2015. Now, off the bat, you think it's getting worse, but Division of Substance Abuse and Mental Health Director Mike Barbieri, he explains the uptick this way.
We're making more services available, so more people are accessing care. So I think that would be one indication of why the numbers are going up. And I think the other is because this is an epidemic, and it is really starting to spread out all over.
So last year, the General Assembly allocated about $4.5 million for additional treatment. How is that money going to be spent?
Okay, so Barbieri says the money will help the state increase its number of residential beds and to expand sober living environments sometime in the first quarter of next year. The state is also working on creating levels of care for outpatients of people, depending on where they are in their addictions. They might seek counseling 3 days a week for at least 3 hours or 5 days a week for 6 hours as part of a partial hospitalization addiction program. Now, put it all together, Barbieri is optimistic that the state can start chipping away at some of these addiction numbers.
Let's hope so. All right, thanks, Shirley. This story and additional coverage related to Delaware's addiction epidemic can be found at newsworks.org/Delaware.